Well, good afternoon, everyone, and thanks for joining us. Dr. Chan, my first time to introduce you today. We're here for a presentation while Dr. Alexander-Scott is taking some family time, and our prayers are with her. I'm also joined by Tom McCarthy, Executive Director of the state's COVID response, Rhode Island Department of Education Commissioner Infante-Green, and Commerce Secretary Stefan Pryor, who will be here to answer questions. Last night, in his address to the nation, President Biden talked about vaccines being a dose of hope. Well, here in Rhode Island, we have hope. 66% of eligible Rhode Islanders have received at least one dose of vaccine. That's 66%, headed towards that 70% number. 44% of the eligible population is fully vaccinated. More vaccinations were done last week than any other week so far. This week we're getting another 16,000 extra doses. That's allowing us to do walk-ins and such tailored community approaches. We are sixth in the nation for first and second doses, according to the New York Times. And according to the NPR, we're third in the nation on fully vaccinated people 65 and older. This progress, remarkable progress, with the hard work of many, many individuals, has been a great experience for all of us and the efforts that have been put in. And it's to every Rhode Islander who has stepped up to get their shots, I want to say thank you on behalf of the state and the whole team here that's trying to make sure that Rhode Island stays safe and reopens as quickly as we can. So we can't let up now. Summer is around the corner, and let's keep going. Let's keep getting vaccinated. On masking, on Tuesday, we updated our outdoor mask guidance to align with new CDC recommendations. Under the new guidance, fully vaccinated people no longer need to wear masks outdoors, except in crowded venues and settings. Masks are still required for everyone in public indoor spaces. This update will take effect in Rhode Island tomorrow. This is a great example of additional flexibility and quickly responding to the national guidelines that just opened up earlier this week on that masking issue. We can continue to keep this incremental flexibility and continue to move in that way as we get vaccinated. So the fastest way through this pandemic is getting shots in the arms. And I know that it's repetitive, but that's the truth. We are well on our way. I know this because I've seen it. You can cover a lot of ground in Rhode Island in a week, and my team and I have done just that. We've moved into the next phase of vaccine distribution, which is all about meeting people where they are. That means physically bringing shots to Rhode Islanders. Yesterday, I visited Electric Boat's new employee vaccination clinic with the Lieutenant Governor, North Kingstown Town Manager Ralph Marlis, and members of the General Assembly. Thanks to a great partnership with Electric Boat, one of Rhode Island's largest employers, 600 appointments were scheduled, but with walk-ins, more than 650 doses were administered yesterday at Electric Boat. If there are other communities, organizations, groups out there that want to get vaccinated, please contact my office. Businesses, nonprofits, churches, we'll make it happen. And high schools, and it won't stop until we break down every barrier and get a shot in the arm of every Rhode Islander who wants one. This morning I visited a walk-up vaccination clinic at a community center in Providence. This clinic is one of several local walk-in vaccine clinics. This one particular one was located opposite, across the street from a local church that was working to make sure that people knew that the vaccines were available. And with the cooperation of the Rhode Island National Guard and the high-density community, the team is supporting all these efforts. The goal is to provide access to vaccines in communities where access to the internet and transportation are barriers. We are also looking to get local in any place that is out there. Again, I'll put a challenge out to any businesses in our state to do the same thing as Electric Boat has done, and Amgen will do later, early next week, I believe, before the end of next week. This is what Rhode Island is all about. We want to be making sure we're buying local, we're eating local, and get vaccinated locally. And I want to share updates on our vaccination strategies, on state beach reopenings, masking updates, and how we plan to get more people back to work safely. On the vaccination strategy, in addition to partnering with businesses, we're also partnering with local colleges and universities for on-campus clinics to specialize transportation to local clinics. Colleges and key players to getting shots in the arms of our young people, and it's instrumental in terms of reopening our universities in the fall. You're going to start to see some fun initiatives with the Providence Bruins and get others and others to get vaccinated. We want to find a way to make sure we encourage people and include all our organizations that are in the state that are doing just that. I was just on the phone with Fidelity Leadership, and they are actually making sure that their staff is getting vaccinated. They're going to partner in with Smithfield High School to make that happen. So we're encouraging those partnerships to continue. We're also announcing efforts to get our eligible high school students and their families vaccinated through this, the 16-plus initiative. Some districts will work with their municipalities, pods, and others will choose to vaccinate the schools right on site. I know that North Kingstown is in the queue, as well as Cranston, as well as Cumberland, Go Clippers, as well as the Johnston as well. Finally, booking an appointment and its resources it takes to do that should not be a barrier to get vaccinated. There should be no barrier in the way. No appointment. There will be no appointment and walk-up strategies and opportunities that Tom will talk about, state-run site, Saconaset, as well up to 9 o'clock in the evening in Dunkin' Donuts and then in Middletown. And there are many ways to get vaccinated, so take advantage of that. Good news, we can't think about Rhode Island summer without thinking about our beaches. Thanks to our team at DEM, I'm excited to announce that Rhode Island state beaches will be open as they traditionally have this summer. That means full capacity, masked in crowded areas like concession stands as we start the season. Scarborough, North, Roger Wheeler state beaches will open on the weekend of May 15th, and most state beaches will be fully open on Memorial Day weekend. Unemployment, that's been discussed, and the incentives and the work search for our businesses out there. So as we continue our reopening, it's time to get Rhode Islanders back to work safely. And I've talked to many employers who are having trouble getting staff back in the building. There isn't one solution to this issue, but we're taking input on ways that we can get it off the ground. We've drafted legislation with our partners in the House and Senate that we expect to be heard next week. The proposed legislation would allow Rhode Islanders receiving unemployment insurance and the federal $300 bonus to work more hours, earn more, and keep more while staying connected to the unemployment insurance system. I know this will give a lot of families a sigh of relief, as many are struggling with tough decisions over the last year. We're also going to be reinstating the requirement that individuals receiving unemployment seek work. This requirement was relaxed during the early months of the pandemic. Now, with high vaccine rates and more restrictions being lifted, this is more of a possibility. So stay tuned for that announcement later in May. And in conclusion, there are a lot of great things happening in Rhode Island, and there's many, many people that are responsible for that. So we're moving into that phase 3 of our vaccination efforts. It's kind of the pick and shovel work right now to make sure that we are doing that last bit of farming and getting us across the finish line safely. But don't forget to make your reservations for Mother's Day. Let's support local shopping, eat local on our Mother's Day, and make sure that we're doing everything we can to get everybody back to work and back into school. So let's keep the vaccination effort going, and let's vaccinate the Ocean State. And with that, I'll turn it over to Dr. Chan. Welcome, Dr. Chan. And thank you for your help as well.
Thank you, Governor, for the kind words. So good afternoon, everyone. My name is Phil Chan. I'm an infectious disease doctor at the Rhode Island Department of Health. Pleased to be here, back with you again on behalf of Director Alexander-Scott and the Rhode Island Department of Health. So Dr. Alexander-Scott usually starts things with an overview of the data situation, and so that's where I'll begin. We had 264 new cases yesterday out of over 19,000 tests. That's a percent positive of 1.4%. We had a weekly percent positive of 1.9%, which is really, really good. In fact, that is the lowest percent positive we have had since the week of October 11th, before we saw our increase and, of course, the terrible second wave that we had in the winter. So we're in a really good place right now, to echo what the governor mentioned. These are case numbers, and again, we can be cautiously optimistic about them. Our fatality numbers and our hospitalization numbers are also down as well. And those decreases are most pronounced in the groups that have high vaccination rates. So the vaccine is working. And that's a theme that you're hearing from the governor, from myself, and you'll hear from Tom as well. For example, our hospitalization rate for people 60 and older is down 80% from its peak during early December in Rhode Island. 80% in people over 60. And yesterday, the CDC released some data that confirmed this trend. The CDC is seeing that fully vaccinated people, adults 65 years of age and older, are 94% less likely to be hospitalized with COVID-19 than people at the same age who are not vaccinated. In that same study, the CDC also found that people 65 years and older who were partially vaccinated were 64% less likely to be hospitalized with COVID than people who were not vaccinated. So what do these numbers show? There's two takeaway messages. One is that these vaccines are extremely, extremely effective. They work, and we know that from the data and now from our real-world lived experiences here in Rhode Island and across the country. The second thing that I want to emphasize is that people really still need to get their second shot of the vaccine when it comes to the Pfizer and Moderna vaccine. That second shot really boosts the efficacy, and it's going to be much more effective against those variants which are circulating around the world and which we still continue to be a little bit worried about. And of course, people who are not, have not received any doses of vaccine need to get vaccinated. There are also some practical benefits to being fully vaccinated. For example, if you are fully vaccinated, you do not need to quarantine if you are a close contact to someone with COVID-19. You still need to monitor for symptoms, but you do not need to quarantine. You also do not need to quarantine after coming back to Rhode Island from a hotspot state if you have been fully vaccinated. Another benefit is that fully vaccinated people do not have to wear a mask outdoors as long as they can keep at least 3 feet from others, as the governor shared. So these are all benefits of being vaccinated, and we know that people who are vaccinated are less likely, very much so, less likely to be infected. As a reminder, being fully vaccinated means that you are at least 14 days from that last dose of your vaccine. So 2 doses again from Moderna, Pfizer, 1 dose for Johnson & Johnson. On the top of the vaccine, one important update that I want to share is what's happened with the Johnson & Johnson vaccine, and the fact that here in Rhode Island, we're going to be restarting the administration of the Johnson & Johnson vaccine in Rhode Island this week. As most people know, the FDA and us here in Rhode Island, based on that, did pause the administration of the Johnson & Johnson vaccine earlier this month. That was after the FDA, the CDC, identified 15 cases of something called thrombosis, that means clots, with thrombocytopenia, that means low platelets, in people who had received the Johnson & Johnson vaccine. This was among millions and millions of people who were vaccinated. These reports and the benefits of the risks and the benefits were all carefully reviewed by the CDC, by the FDA, by us at the Rhode Island Department of Health, by our vaccine subcommittee, by teams of doctors and scientists, and last week, the FDA and the CDC did recommend that states can restart administering the Johnson & Johnson vaccine. Healthcare providers are now aware, including in Rhode Island, of this extremely rare health event and how it should be reported in treatment. We've done a lot of work at the Department of Health across the last week in updating providers, physicians, nurse practitioners, PAs, others, about how to report and identify the risk of this thrombosis with thrombocytopenia. And as Dr. Alexander-Scott mentioned last week, this is why these safety systems are in place, and the fact that we even identified initially 6 cases of this across millions and millions of people being vaccinated shows that these safety systems are working, and that's certainly a comfort to me. Our message, my message today, is still 100% to get vaccinated. If you have questions about the Johnson & Johnson vaccine, please do talk to your healthcare provider. If you believe that you're at risk of clots or other clotting, keep in mind that we also have the Pfizer and Moderna vaccine, which do not have the risk of clots that we know of. So 2 other vaccines, even if you don't feel comfortable getting the Johnson & Johnson vaccine. And as I shared earlier, the case data is promising. We're really in a good place. Things are trending in the right direction. But unvaccinated people are still at considerable risk. And this is because of the variants, including B.1.1.7. We know that variants like B.1.1.7 and others are more contagious, and that's why we're still seeing hundreds of new cases every day. And with that in mind, I do want to reiterate that in addition to getting vaccinated, you can substantially reduce your risk of infection of COVID-19 by gathering with people, if you do, outside and not indoors. And I really want to emphasize that. As this pandemic has progressed, we have realized the importance of just outdoor ventilation. So if you had to pick among many different things, gathering with people outdoors is really one of the best things you do compared to a smaller indoor enclosed setting. And as the director shared last week, we've been talking about a lot of restrictions and those being loosened. I want to be clear too that you can always choose to be a little more cautious and careful compared to what we're suggesting. That's okay. Again, what we're talking about up here are the minimums that people have to adhere to, but people can always choose to be more careful and more cautious. If you do want to be more careful in terms of wearing masks outdoors or keeping your group small, that's totally fine, certainly from a public health perspective. And personally, in a lot of scenarios, again, my family and I have a 10-year-old and a 13-year-old, soon to be 14, continue to go that route. So as we know, the vaccines are only approved for individuals 16 years and older. And so as a parent, as a father, I do continue to be somewhat careful given that my kids cannot be vaccinated. I am optimistic, as some of you may know, that in the coming months, we should see vaccines, especially for 12 to 16 years of age and older. So vaccines for children, for adolescents younger than 16 are in the very near future. More to come on that, and obviously a good note. And finally, I just want to end by thanking all my colleagues at the health department, also in the healthcare field across the state, and also all of state government for their work on the pandemic. There's literally thousands of people involved in this effort. I'm up here representing some of them, but just want to really send a heartfelt thank you to all of them. And with that, I will turn it over to Tom. Thank you.
Thank you, Governor. Dr. Chan, for those updates, and hello, everyone. So a lot of work still remains, but today is definitely a good news day. Many of the initiatives that the Governor shared, such as our partnership with businesses and our work at colleges and universities and with municipalities and high schools across the state, are reflective of our transition in the vaccine effort from Phase 2 to Phase 3. If you recall, in Phase 1, we started by focusing on those Rhode Islanders that are most vulnerable and highly specialized populations, such as residents of congregate living settings and healthcare workers. In February, we transitioned to Phase 2. During Phase 2, we were primarily using an age-based vaccination model, and our aim was volume, vaccinating as many Rhode Islanders as quickly as we possibly can. Both Phase 1 and Phase 2 have been extremely successful. The numbers make that clear, both in terms of vaccination rates and in terms of our health outcomes that we've seen. Now in Phase 3, we have that same sense of urgency, but our approach is much more about meeting people where they are and making vaccinations as easy and convenient and accessible as possible. This is the pick and shovel work that the Governor spoke about, putting vaccines in the path of Rhode Islanders each day. There are some people that don't have enough time to head to a clinic to get vaccinated, but they would if we had a clinic in their break room at work. There are some high school seniors who have trouble getting to a vaccination clinic, but would be vaccinated if there was a clinic in their gymnasium. And there might be some people who didn't register to get vaccinated, but maybe they would if they had the opportunity to not have to make an appointment or pre-register. And we're offering that in Providence, Cranston, and at our Middletown mass vaccination locations. You can show up without an appointment, and if supplies available, get a vaccine. And that is effective as of today. So with regards to those no appointment vaccination opportunities, the Saconaset site is open Tuesday through Saturday from 8 a.m. to 9 p.m. The Dunk is open Tuesday through Saturday from 9 to 6. And the Middletown site is Wednesday through Sunday from 9 to 5. Also beginning today, appointments will not be needed to get vaccinated at CVS, Walgreens, Walmart, and Stop and Shop, again, as supply allows. No appointment vaccinations will be happening at roughly 80 pharmacy locations throughout the state. Again, all of this is about making vaccines as accessible as possible. Because vaccines are more and more accessible now, one change we are making is to phase out our pre-registration system, which we've been calling the Vaccine Interest Notification List. Anyone who signs up between now and May 2nd will get an appointment, but we're going to stop pre-registrations on May 3rd. We've already made it all the way through the list, but if you sign up today, you'll still get your appointment. Another change that we're making is we're shifting away from our large release of appointments on Tuesdays and Fridays that we've been posting on vaccinateri.org. With us getting into more targeted settings and with us making more no appointment opportunities available, we can be more nimble and more responsive throughout the week to demand by posting smaller amounts of appointments each day. So every single day, there'll be appointments available on vaccinateri.org. However, if you want to get vaccinated at one of the state-run sites, making an appointment in advance is always the best way to go. That way we can guarantee that we have a slot available for you. I'll wrap up by saying that the good news we have to share today is a direct result of everyone's hard work, patience, and collaboration as we've worked through our vaccination campaign since December. We're doing great, but we still have a lot of hard work to accomplish as we move down the home stretch here. So please do your part, get your shot, help others get their shot, protect yourself, your loved ones, and all Rhode Islanders. And with that, I'll pass it on to Commissioner Infante-Green.
Thank you, Tom. Hi, I'm excited to be here alongside Governor McKee because we're happy to report that this week, after the vacation, we know that the majority of our schools are back in person. So it's been a Herculean effort by the schools, the teachers, the educators, the municipalities, all working together to make sure that vaccines have been available to our educators. So we're really excited about the collaboration and very grateful. Throughout the collaboration, we're seeing the shift in our schools. So over the break, we reached out to school leaders to get a sense of where we are as a state. So at this point, there is no school, either an elementary, middle, or high, that is full distance learning. In fact, 208 out of the 265 schools that responded are fully in person. And approximately 97% of public schools at the elementary and middle school levels are learning mostly fully in the classroom. At the elementary level, there are 34 out of the 35 of our public schools are currently in person, either learning 4 or 5 days in person. So that's really exciting for us. At the middle school level, 33 out of the 34 of our public schools are currently in person, learning either 4 or 5 days in person. This is progress and speaks to our families' confidence in the work that we've been doing collectively to get our students back to school safely. But I do have to underscore that each day that passes without students learning in the classroom only impacts the disruption that has been caused by the pandemic. So I know that many of you are still worried, but if you're listening, parents, please, if you're worried and it is not a medical reason, the mitigation efforts that have been put in place are working. Look at the data. Keeping our children healthy is our main priority. But we know from the very beginning that schools have been one of the safest places for our kids. So now, with the efforts of the municipalities to vaccinate our 16-plus population, we can provide even more protections to our student population and their families. Vaccination is one of the best ways to protect our students both in and out of school. We've seen how devastating the pandemic has been for our students over the past year. The distance learning only amplifies that effect. So please consider the last 2 months of our school year that you do send your child to school if you have the ability to do so. That's why, thinking about all the disruption that we've had, we put together a task force, the Learning, Equity, and Accelerated Pathway Task Force. We call it LEAP. And we spent the last 2 months poring over the data and looking at what it means for our kids. So one of the priorities that has been the report brings forth is the importance of in-person education. We've known it, we've been saying it, but it is in black and white. And then also, what are the pathways that we need to put in place in order for us to accelerate the learning for our students? So we are really excited about the LEAP report. If you have not seen it, it came out yesterday, and all the recommendations. And we looked a lot at the data. Data is really important. As you've probably heard before, everybody's talking about learning loss, but nobody really knows what that looks like. That's why the RICAS is more important this year than ever, but also really looking at where we are at this point and how we support our students moving forward. Because the plan came out yesterday, that doesn't mean that we started the work yesterday. So we already have built on Enroll RI a plethora of opportunities for the summer. Starting Monday, parents will be able to look at all the applications, all the opportunities for their students available free statewide. So I'm really excited about this opportunity as we move forward and as we continue to bring our kids into the building. We are going to beat COVID. We know that. As Rhode Island, we have always been on top of that. And you hear where we are with the vaccinations. Now we need to really focus in on making sure that our kids, that we make up the time with our kids and make sure that we provide them with accelerated learning as we move forward. Thank you.
Why hasn't there been a push by you to, I know that most of the schools are back fully in person, to mandate that as Massachusetts has done?
Yeah, so I mean, we made the effort to make sure that teachers were vaccinated before Massachusetts, by the way, and make sure that the supportive staff, along with our child care, were vaccinated and the supportive staff. I think you're going to see, I've mentioned that we're going to be fully opened in September, and I think that you're going to see that there'll be positions that we'll take at that point in time. Right now, the preference is that people would be in school. So I visited a high school yesterday with the commissioner and the superintendent, and we want to make sure that the students and the families know that they're safe. So we're encouraging it right now, during the balance of the school year. That's the reason that we vaccinated the teachers, and we certainly will be supporting the commissioner in a all-in strategy in September that we'll be talking about next week sometime.
You had mentioned a couple of weeks ago that you presumed that wearing masks would still be part of going to school in the fall. Do you still believe that to be the case? And as outdoor mask wearing rules are being eased, do you foresee any of that indoors anytime soon?
So in the schools, I've asked, I was asked this question again publicly yesterday. I only can tell you what I know at the moment. Before Tuesday, when CDC came out with their new guidance on the mask, we were holding true in terms of what, the policy that we had. We changed it quickly. So if there's changes in the science and in the medical area that makes sense, that's fine. But right now, my understanding is that there would be masks in the schools in September, but that all can change based on advice that we get from the health department and from both nationally and locally.
Governor, any thought of paid sick time for people who have had the Pfizer, Moderna, or any shot, Johnson & Johnson, and are sick and unable to work for a day or two after they get the vaccine? Some people are writing in and saying that for up to a week, they're having to take naps. Is there any thought of doing something like that?
Well, I guess you would take it on a person by person basis. If we knew that what was what you're referring to, Bill, then we certainly would follow up on it. I think if it becomes a problematic area in a large way, we would address it officially. But I would think at this point in time, they would work it out with their employer.
Governor, were you surprised the resignation you received this morning from Courtney Hawkins?
Yes, I mean, surprised in the way that the first time I heard it, right, in terms of resignation. I believe it's effective as of May 14th, but and we'll work with the director along with to make sure that we replace and have the department running during the transition. So yes, so I mean, a surprise to the point where you're always surprised to see the thing for the first time, but I know that Director Hawkins, in terms of even my transition, was very, very highly thought of in all the recommendations I received. That's the reason that I offered to have her continue to be director, and she accepted. So we'll follow up with her personally, during the next week or so to make sure there's a smooth transition there.
I just want to follow up. It was reported you made an unexpected visit to Zambrano Hospital yesterday. Can you touch on again the problems with that and Eleanor Slater? And granted, you inherited both, but what can you say about the unexpected visit there?
Well, again, we're trying to come up to a recommendation, John, in terms of what we're going to do. I don't think that we put a hold on that. That's not the only work that's being done. We've got people in our office, Joe Almond included, who is really focused directly on that on a daily basis. So this was part of the the effort, right, to get an updated. We met with the doctor up there last night, walked through with our acting chief of staff. It's all in the due diligence. It's all into trying to figure out. There's no easy answer there, as you can imagine, and we want to make sure that we're touching all the bases. And a visit there made sense to do it at this time. We really want to get something. We really want to make a recommendation before the General Assembly leaves in this session. We put in a very high dollar number to be, potentially to be in a building, whatever it might be, but we still need to make sure the plan's there, and the goal is to have something there before the end of this session with the General Assembly.
Is that just a message to all departments across the state? They should operate with the expectation that at any moment, Governor McKee could come walking through the door.
Yeah, that's the way. It's a management by walking around, and we've communicated that to all the department heads. I've already been in several departments. I intend to be in all the departments during my first 100 days. I think I'm on day 57 right now.
Specific questions if we can. Pat, Amy, Anita.
Right. Governor McKee, despite federal tax exemptions, the state wishes to tax PPP loans. The state wishes to tax full unemployment. With billions of dollars of federal aid on the way, and a state government that has not issued furloughs nor inflicted any real salary cuts, why is the state hell-bent on taxing the individuals and businesses most impacted by COVID?
Yeah, so let's talk about the PPP, all right? We exempted 90% of the businesses that borrowed on the PPP. So if anybody's out there saying that we're not addressing the small businesses, they're misinformed. So 90% have been exempted because 90% have borrowed $150,000 or less. So let's make sure that that's very clear to people. There's no attack on the small businesses. In fact, I'll repeat that we protected 90% of them. The businesses in the balance have earned a great deal of money. And so the question is who pays their fair share? So my position has been that we exempted the overwhelming majority of the small businesses that struggled. But many of these businesses who borrowed $4, $5, $6, $7, $8, $9 million, they're making hundreds of thousands of dollars, if not reporting millions of dollars of income. So I think it's fair that people pay their fair share, and I feel comfortable, as I said before, that I'll stand by the budget. By the way, a budget that had to be done by March 11th. And there was over a $300 million structural deficit when I actually got into the discussion, and we handed a balanced budget to the General Assembly, and it would have been, we would have had to go at $70 million of cuts, so $70 million of programs that didn't get funded. I believe that we're in a good spot. The General Assembly will make up the decision, and if they can find a better way to do it, then then I'm not going to veto a budget because somehow that got filled. But I think you're going to find that the general public is going to be supportive of an issue where people who need the help, the tax relief, get it, and the people who don't need the help at this point in time, a small amount of businesses, they pay their fair share.
So if I could follow up, please. The decision to tax full unemployment, are you arguing that Rhode Islanders are in a position to be taxed on unemployment when virtually the rest of the nation is following the federal exemption? And again, no shared sacrifice on state government.
We can talk about it offline, Pat. We'll email. Amy?
Ever since April 19th, it seems that every time you check the vaccination portal, there are thousands of appointments still available, even today. And do you think that maybe not enough young people are getting vaccinated? Are you worried about that? Or is supply just more than we need?
Well, again, I want to make it again, clear that last week we vaccinated more people than any 6-day period since we opened up the vaccination sites. So that means there's still a great deal of people willing to get vaccinated, right? And now our work is, as Tom and the doctor mentioned, is really get out in the communities. I think you're going to find that the young people are going to respond as any age group does in the state of Rhode Island, that they're going to get vaccinated because they want to get their lives back as well. They want to go to the proms, right, in the high school. They want to be at graduations. They want the families to be at their graduations. The vaccines is a route to do that. So I'm not concerned yet about that because we're talking to universities in that age group as well. I believe that there's over 60,000 students in the state of Rhode Island that live in Rhode Island that attend our local universities that are going to be vaccinated before September. So the verdict is out on that. We're certainly cautious, but very optimistic that we're going to hit the numbers that we need to in every age group in the state of Rhode Island.
Governor, are there plans to have high school vaccination clinics in hard-hit cities, Pawtucket, Central Falls, Providence?
We're offering to any school district in the state, any LEA in the state, to have on-site. Like I mentioned, I think we're going to be in North Kingstown next week. We're going to be in Johnston, my hometown of Cumberland, as well as Cranston. So any high school that is interested in having it on-site, we will make sure that happens.
Reached out to you, any of these hard-hit zip codes?
I don't have the list yet, but I know we've made the offer and we're making the contacts through the municipalities. I would expect that that's going to really ratchet up, and I would expect to be in high schools around the state, including the communities that you just talked about.
Lastly, in regards to, I know we're talking about graduations. I know this is particular, but will you be handing diplomas? I know some of the guidance I think RIDE sent out to schools aren't updated with the current guidance. So what is that going to look like, and will schools be updated with this new guidance?
I don't know the answer to that. I watch Wheel of Fortune every once in a while. They put a little cylinder there and they turn it around. So there's got to be a way that we're going to be able to hand those. The main message there, and I'll let the commissioner weigh in, but the main message is we want everybody to get vaccinated, including the high school students, so that they can have a graduation that they didn't have last year. And the opportunity is there, and we're going to try to do everything we can. It's an important day in the families and the students, and we want to make sure we honor that.
Yeah. And the EDUC is working with the superintendents, and there will be clarity around what the logistics of all that will be.
Would you rule out carrier pigeon? No. Johnson & Johnson vaccine now back in the rotation. Are you seeing people wanting that one versus the other? A Moderna shot is a 6-week process. Pfizer is 5. Johnson & Johnson, one and done, and within 2 weeks, you hit, as you explained, the 2 weeks after. Are you seeing people want that? Because it seems like there's been a drop-off of people clamoring for the vaccines at the pause, and are we going to get more of the J&J?
Yeah, so all great questions. So I will say that we've just lifted the pause, so it's a little bit early to tell. I do encourage people, certainly if they have questions, to talk to their healthcare provider. Again, reminding people that may have be a little bit predisposed to clotting. There's a lot of different health conditions that may predispose one to clots, thromboses. That there's 2 other vaccines out there, right? The Moderna and the Pfizer, and those have 0 safety signals in them. So there's different options. The benefit, of course, of the Johnson & Johnson is that it's 1 dose, 1 shot, and then you're done. Also keeping in mind that even the risk of clots is really incredibly rare, and I can't underestimate that. So really incredibly rare. But again, if people feel uncomfortable, talk to your provider. Also consider, of course, the Moderna and the Pfizer vaccine.
With the open appointments, Dr. Chan, I know the governor had said before he'll be concerned when the vaccines don't get used. So there have been thousands of open appointments. What happens? Is there a vaccine that's not being used, or does it just get pushed another week?
It just gets reallocated, and that's a big part of our shift to, away from those Tuesday, Friday releases. So every single day we're monitoring the uptake, what the availability looks like. So it gives us a higher degree of flexibility, which is why we're able to go to businesses, go to schools, go to community events. So none of this is going to waste. Our waste is still less than 1/10%, which is unheard of in vaccines. And we're just reallocating it, in real time, very dynamically.
Anita? Tom, how are no-show appointments going? I know you saw an uptick. What was the status on that?
It's remained consistent at about that 10%. Now that we have the walk-up vaccinations, though, that's kind of made up for what we've seen with regards to no-shows.
Governor, are you
Hi, Tom. Is there ever a point where the federal government will stop shipping vaccines sometime after July 4th when we're not going to have all these large shipments come in?
Yeah, we don't have a date for that yet. Eventually, right? But I think a couple of things on the horizon. One is, approvals for probably the next group, as Dr. Chan mentioned, 12 to 15, which we're hopeful, is sometime this summer before school starts. And then, even younger Rhode Islanders, which for planning purposes, we're thinking sometime in the fall. So I think throughout most of the summer, we'll continue to see shipments. What those look like, we're not sure. But I do know, the Pfizer and Moderna production is at peak capacity. We're getting enough doses. Supply is meeting demand, which gives us this flexibility. So we're in a really strong position.
Governor, are you concerned? There's a story in this morning's Boston Globe that our unemployment's over the national average, but retailers, restaurants, manufacturers still are having a very difficult time trying to get workers in, employment agencies. There are several types of businesses that are actually starting to close because they can't get the staff to work at a restaurant on a Monday night or to be there on a Sunday night.
Very concerned, and we followed up with a piece of legislation that I think is going to help in that area. We're also going to make sure that as we implement that people are going to be need to qualify that they're seeking work to be able to collect unemployment. That's coming, and also. When we move to protecting people that are coming off unemployment on that $300, John, I'm expecting as a small business owner that small businesses will provide the same work schedule to people who have been working and have been paying, really very loyal to these businesses, that they're going to probably do the same thing. So I'm not as concerned about the unemployment rate at this point in time as I am in terms of the work rate. We want to make sure our businesses have the number of hours that they need to run their businesses, because we're going to have a really good summer, and we're going to want to make sure that we take full advantage of the economic upturn that is coming that we fully expect.
Dr. Chan, there's still some people out there.
Oh, sorry, Stefan, do you want to?
Just to add to the governor's points on the UI bill, we're very pleased that with cooperation both from House and Senate leadership, there is a bill that is moving, authored by our Department of Labor and Training with the House and Senate, and we're very pleased to see that happening. It enables individuals on UI to earn up to 150% of their benefit amount before they are removed from UI. Currently, it's 100%, and they can also earn up to 50% of their benefit before the earnings are reduced. We can explain more if folks are more interested, but that's what the governor is referring to, and is absolutely correct in saying that has momentum. Thanks to leadership in the Senate and House, they've taken their own initiative to try to move this forward, and we hope that in the next couple of weeks there can be actual passage in some form and movement to final enactment of those bills. So that will help. The other thing I just wanted to say, for those individuals out there who are in fact seeking work and are hearing this and thinking, goodness gracious, I would like to find a position and get employed if restaurants have availability, if other establishments have availability, we have a website, backtoworkri.com, that the Department of Labor and Training in partnership with others maintains, and we can actually help assign a job coach. We can connect you with businesses that are searching for work. We can connect you with postings, because there are in fact so many openings out there.
What about lifting restrictions for bars, restaurants, nightclubs?
Those are on the way. So there are several moves that are occurring related to bars and cocktail hours in catered event contexts, May 7th and May 28th. So May 7th, outdoor bars will be able to reopen inclusive of standing service, and May 28th, that occurs indoors and outdoors. So we're encouraged that will be occurring. By the way, bars are open in the sense that they can operate right now for seated service only. And for the majority of the pandemic, we've gone to great pains to create a safe condition under which bars can operate.
You envision restrictions on bars being lifted as more time goes on?
Yes, May 28th, for all intents and purposes, bars restrictions will be lifted. The caveats on all of these points are, one, mask wearing indoors whenever not consuming, that is to say, eating or drinking, and the 3-foot rule between people whenever possible. But yes, those restrictions will be lifted.
Bill, Pat, Alexa, and we'll end there.
Dr. Chan, good afternoon. There's still some people who are out there shockingly saying that masks don't work. There's no evidence to connect that they've had anything to do with the pandemic. There's at least one person who claims to be a medical doctor constantly saying this on different channels here in Rhode Island. Now that we're shifting to an indoor mask-specific requirement, what do you say to these people?
Yeah, I will say that there is evidence for sure that that masking works. It's something that we've done in the healthcare field for decades and decades, commonly accepted. And so this goes back to one of my points about indoors versus outdoors. Outdoors is so much safer, just with that open air, more room to physically distance. It's really that indoor setting that we need to be more careful about. And we know that masks especially protect others around you. Again, we know that up to 50% of COVID is asymptomatic. So if you unknowingly have it, the mask will prevent you from transmitting to others. So it's not just all about you personally, it's about the people around you and protecting them. And of course, we know that masks will also protect you, the wearer, from others around. So there's a lot of evidence that has accumulated. We do need more evidence. I want to point that out as well. There is still some limited evidence. And during this pandemic, as we've seen in many things, we're still learning every day. So more to come. But to date, the preponderance of evidence does show that masks are effective.
Governor McKee, two things. Number one, under the proposed McCarthy legislation, is that going to effectively limit the amount of hours that someone can work depending on their level of compensation? In a sense, creating a situation where you're going to have a balkanized work week, leading to all sorts of training issues and scheduling issues. And also, I wonder if you could follow up on the notion that Rhode Islanders' personal unemployment insurance should be taxed in its totality.
So first, we've worked with the restaurants and other people who need employees, and they are supporting the legislation I believe you're referring to. So, they'll manage it. And then, second of all, remember, on the unemployment issue, when I had the deadline of March 11th to put the budget in, the federal guidelines were we didn't even know that there was federal dollars coming in. And right now, we're still looking at what you can use those federal dollars for. It is not clear that you can use those to cover any lost revenue that you would be anticipating. That could become clearer. So it becomes an issue with what you're talking about in terms of the PPP for the 10% of people who made some money wanting to get relief. And in addition to that, on the unemployment, it's about $100 million that the General Assembly would have to figure out how they're going to balance the budget. In fact, they do either one of those. And so we'll see what happens there.
Let's follow though. And no one's doubting the work ethic of state government, but at the same time, throughout this entire process, there has been virtually no shared financial sacrifice by folks in state government. I would question, and we've done this before, whether anyone at this table has had to take a salary cut. At the same time, you're looking to tax, again, on a federal level, tax-free unemployment compensation to the Rhode Islanders who have suffered the most.
I've answered that question. At the time we put the budget in, we'll get through this, that was not an option that you could consider at $100 million. We had to balance a budget. Look, Washington prints money, Rhode Island doesn't, and budgets are difficult, and that's what they're all about. But these questions are what I believe we're going to have another open Tuesday press conference, and we want to focus on those issues at that point in time.
Governor, you said that businesses and nonprofits, if they want vaccine clinics to just basically come to them, just to contact your office, is there any minimum requirement for staffing, what type of industry they're in, or what their facility even looks like in order to bring shots right to them?
Right now, it's, if we can, the community center that we visited today, National Guard was there helping facilitate that vaccination. I believe about 40 people are going to get vaccinated. So And then yesterday at Electric Boca it was 650. So, it's a wide range, but we'll go anywhere where it makes sense. And then if somebody's got a handful of people, it may be just a personal visit to them. I know that this center was actually doing a personal visit today through the National Guard of somebody who was still, didn't have the access to a vaccine and wanted it. So I think that we're going to be very, very flexible. If it makes sense, we're going to do it. And if we need to give guidance to individuals that are, contacting our office, like Fidelity today, they're going to Smithfield High School. So we're going to be able to figure out a way. We just want people to call and that they identify that they have an interest and they haven't been vaccinated. We're going to get them vaccinated.
Like if a restaurant or retail store that would contact you and said, I want shots to come.
No, we would go to a business as well. We would go to a business, a community center, a school. We'll go where they are. We have piloted a little bit in the restaurants in both Newport and the Providence area. So we're prepared to go virtually. We'll go to an office building. We're talking to a couple office building owners right now that feel as though they could get several hundred at one time. We're talking to a business that's, there's a bank, a large bank that has their corporate headquarters in Johnston that we're talking about potentially going there. So, we're open to the calls and we'll make it happen.
Thanks, everybody.
Thank you.
Email and follow